Okay, good morning, madam. Okay, my name is Mahendran and my leader name is Durkashini. So our mini project title is Heart Disease Diagnosis Expert System. Okay, next. Okay, first is background of study. An advanced technological tool called a Heart Disease Diagnosis Expert System is intended to help medical personnel correctly identify and categorize various heart problems. The approach makes use of a thorough background examination of cardiovascular disorders, which cover their cause, risk factor, symptoms, diagnostic procedures, and available treatments. In order to analyze patient data, including medical history, physical examination findings, and test results, machine learning algorithms, and medical knowledge databases are used. The expert system can produce accurate diagnosis recommendation or offer differential diagnosis based on the interpreted data, apply logical rules and algorithms. The system's goal to increase the precious effectiveness of cardiac disease diagnosis, enabling early patient intervention and the use of the most appropriate treatment options, ultimately leading to better healthcare outcomes. The next is problem statement. There are three problem statements in our project. First is inaccurate and delayed diagnosis. Due to the variety of symptoms and the potential of incorrect interpretation of diagnosis testing, diagnosis heart disease can be difficult. Patient outcome may be impacted by a misdiagnosis or delay diagnosis brought on human error or lack of access to current medical information. The second problem is variability in diagnosis expertise. Healthcare provides knowledge and experience in identifying cardiac problems can differ. The third is rapidly evolving medical knowledge. Cardiology is a field that is continually changing, with new studies, method of diagnosis, and treatment recommendations being published frequently. The most recent development can be difficult for healthcare practitioners to keep up with. Okay, the next objective. There are three objectives in our project. First is improve diagnostic accuracy. To analyze patient data and deliver precise and trustworthy diagnostic recommendations, decreasing the possibility of misdiagnosis and improving patient outcomes. The second objective is assist healthcare professionals to help medical professionals by acting as a trustworthy and effective diagnostic tool. The third objective is to improve access to the expertise by offering uniform and standardized diagnosis help. To solve the issue of variability in diagnostic competence. The fourth is scope to provide diagnosis support for healthcare professionals in identifying and classifying heart disease. Second is to analyze patient data, including symptoms, risk factor, medical history, and test result. The third is the system also will provide diagnosis recommendation based on okay. Next.
Okay, next is about the highlight of domain expert. This is the highlighted domain is about medical professional, which has a specialized knowledge of education and experience in each cardiovascular and health is considered as a domain specialty of in heart problem. And next is by these professionals have their overall or overall they have their awareness of the heart architect, the physiology, and the pathology, as well as there are different types of illness and diseases that can be affect it. And also as a cardiologist, cardiac surgeon, cardiovascular researchers, and also the allied healthcare workers can be considered as a domain expert in this heart problem. And they are also the extensive of knowledge of variety alignments including the congenital cardio abnormalities like heart failures and more. Next, okay, we have four types of heart problem. First is valvular heart disease. It's actually about the heart which has affected. It has been age-related degeneration, and also it has many other factors that can be affected by this disorder. It has been how to say, it's like the common things we will be having heart breathless, exhausted, and moreover chest pain and more. And next is about the physical examination they should have is by having an angiogram and also more. Next is arrhythmia, which is a term of having irregular heartbeats that throws off the heart typical rhythm, and also it may have a heartbeat of too quickly or too slow. Next is coronary artery disease. This is a common disease that can be known. It has its restrictions or obstruction of the coronary arteries, which can be provided oxygen, nutrition of the heart muscle. And next is the disease is congestive heart failure. Okay, this disease is a very dangerous condition because it may make the heart to be unable to pump efficiently. It may produce fuel to accumulate that congested in the lungs as well. And next, about the significance of the project, expert system has its great improvement diagnosis, which have been precision, and it can be analyzed about the patient's data and often be trustworthy diagnosis recommendation by the utilized cutting edges algorithms and also the medical knowledge sources. Next, it also can be dealt with the problem of diagnosis expertise variability, and it also guarantee about the healthcare practitioners. Okay, and also it will be irrespective of their level of experience and having the access to the most recent medical information and the recommendation by offering by the doctors as well. Next is the system can be boosted productively and resources of utilization in the system healthcare industries, and it also can be optimized resource allocation, streamline the workflow, and be shorten the time needed for the diagnosis as well. And next, this is our knowledge accusation about our 4 diseases. These are the symptoms. All of these diseases have the same same symptoms, which are shortness of breath, fatigue, dizziness as well. But except in coronary artery disease and congestive heart failure, there are a bit extra things which has been have emotional stress in coronary artery disease, and here's the hypertension and as well. There are some things as well. Next is the knowledge representation. Okay, the production rules are, these are the first rule for the patient. If the patient has the symptom of dizziness or fainting and fatigue and chest pain, and as well as a short breathness, and also having a history of heart murmur on physical examiner, then it has been diagnosed as a valvular heart disease and recommending to adopt a balanced diet as well, and avoiding the smoking to promote the cardiologist health. Managing the heart rate through the appropriately medication and the intervention if it's necessary. Next, the second rule. If the patient is experiencing dizziness, fainting, having shortness of breath, and also chest discomfort and fatigue and irregular heartbeat, and also no history of coronary artery disease, then the diagnosis is arrhythmia, and also recommending an ECG and doing the physical activity as well, having their healthy weight by eating and balanced diet, and avoiding excess caffeine as well as alcohol assumptions, and also try to manage their stress levels. Rule number 3 is if the patient experiences shortness of breath, fatigue, chest discomfort, and has a history of emotional stress, and also has risk factors which has blood pressure, high cholesterol, and smoking. Then they are diagnosed as coronary artery disease. They are recommended for further diagnosis tests like stress tests, consume ACE insumption, and also having a heart healthy diet, regulate their physical activity as well, and avoiding their smoking as well. And next is rule number 4. If a patient has a symptom of fatigue, shortness of breath, irregular heartbeat, wheezing, and also swollen aches, and having a history of hypertension, then their diagnosis of congestive heart failure, because they have to be recommended as a balanced diet, weight management, and avoiding smoking, alcohol as well, and they must be prescribed about aldosterone, estrogen to reduce the fluid retention, and also recommending for an angiogram and blood tracers for the cardiac enzymes. The next, these are the questions for valvular heart disease, arrhythmia, coronary artery disease, coronary artery disease, and this is coronary heart failure as well. And these are the codings for the system. And same as well, this is the output of our system. And this is our conclusion. Our conclusion is by finally having the analysis. This is a very serious and complicated heart problem which have a wide range of form and symptoms. And as well, this expert system will increase diagnosis accuracy, lowers the variability, and boost the efficiency of by utilizing the cut-edges algorithm and also the medical knowledge database. It offers also the invaluable assistance to healthcare professionals in decision-making, resulting in promote inventions and also individualize the treatment of programs. And the recommendations are, first of all, is healthy lifestyle. In whatever medical problem, the first thing we should do is healthy lifestyle. Next is medication, and having routine medical examination and screening as well. If possible, is 6 months once. And next is we have to manage our stress level also. And the next thing is try to limit the alcohol consumption and also smoking as well. And next is by having everyone need to have their education and support from everyone as well, from the teachers and our parents. And next is, this is our role and responsible that we have done. So thank you. And this is our reference. Thank you, madam.
Thank you, madam.